Hi everyone, this is Med Corner with a new video about ABGs. So let's talk about ABGs. It is the single most important investigation that helps in the patient management in ICU setting. So we will start with our normal values. These are the things that you need to remember by heart without any concept. So our normal pH value is 7.35 to 7.45. So next one, I want you to remember the normal values of partial pressure of carbon dioxide, PCO2, that is 35 to 45 millimeter of mercury. Then comes the partial pressure of oxygen. Well, it is from 80 to 100. And fourth most important component is bicarbonate levels. Bicarbonate's normal value is 22 to 26. So these are the four most important values that you need to remember by heart without making any concept. So a little bit about these gases. CO2. Now, this one is very important for your concept about ABGs. CO2 is an acidic gas. You must remember from the chemistry, CO2 is acidic in nature. So, any increase in quantity of CO2 or partial pressure of CO2 which leads to the more acidic pH, okay, and removal of this carbon dioxide from the blood will leads to the pH that is more towards the basic side, that is alkaline. Another thing about carbon dioxide is that it is Another thing about carbon dioxide is that it is primarily controlled by lungs. So let's make a concept about bicarbonate. Bicarbonate is basically a base in nature. So any increase in the quantity of bicarbonate in the blood will lead to the pH a more alkaline. And on the other hand, if there is a loss of bicarbonate in blood, it will make the blood more acidic. It will drop down the pH from 7.35 to more downward fashion like 7.34, 7.30. Just remember the normal values. Less than 7.35, the more lesser it will be, the more acidic it will get. What about oxygen? Well, from the chemistry point of view, it is neutral in nature. It does not have any significant role in the determination of pH of the blood, means it does not hold any effect whether its quantity increase in quantity or decrease in quantity will make the blood more acidic or alkaline. So if I will talk about the pH of the body, our body is in a constant state of trying to maintain the homeostasis, to maintain the pH in that specific range of 7.35 to 7.45. Doing so, it's a constant play between CO2 and bicarbonate. You know, CO2 is primarily controlled by lungs, while bicarbonate are primarily controlled by kidneys, though many other factors, but these kidneys will have a profound effect over the bicarbonate levels, and carbon dioxide will be primarily controlled by the lungs. As I have told you already, that CO2 is an acid in nature, while HCO3 is basically a base in nature. Primarily, CO2 is controlled by lungs and it has a very fast adaptability. While this bicarbonate, it adapts relatively slow. So bicarbonate, it adapts relatively slowly. It is responsible for the metabolic component of pH, while this one, carbon dioxide, is mainly responsible for the respiratory component of the pH. By that mean that any change in CO2, carbon dioxide, is primarily done by the lungs and it will have a profound effect on respiratory acidosis, respiratory alkalosis, while the bicarbonate that is basic in nature will be controlled primarily by the kidneys and will have the profound effect on metabolic acidosis and metabolic alkalosis. So, what are the components of this carbon dioxide that is controlled by the lungs? It could be acidosis, primarily respiratory, and alkalosis, that is also respiratory. What happens? So, as a rule, CO2, I have told you that it is acidic in nature. So, any increase in CO2 will lead to the accumulation of acid. So, any increase in the CO2 levels will make the pH go down. It will make the pH to be more acidic. And on the other hand, any decrease in CO2 will make the pH go up and it will make the pH more alkaline. I told you that CO2 is acid. What happens if you remove the acid from your blood? The pH is going to be higher than 7.45. It will become more alkaline. And if you add CO2 into your blood, it is as it is an acidic gas, your pH will become low. It will move from 7.35 to the more downward side, like 7.33, 7.32, 7.30. Like it will be going to the more acidic side. In the same way, metabolic components will be acidosis and alkalosis. As I have told you, that bicarbonate is basically a base. So, what will happen if you remove the base from your blood? The pH is gonna get low. pH will be more acidic. It will be less than 7.35. On the other hand, if you add a base like bicarbonate to your blood, what will happen to pH? It's gonna get higher. Higher, it means higher means that it will be above 7.45. It will be 7.50 or maybe more than that. Now, another important point is that how does this body achieves the state of equilibrium. How does compensation occurs? For example, if a person is having more acidic blood, the pH of the blood is on the lower side, we need to neutralize it with a base to achieve the equilibrium. In the same way, if the blood gets more alkaline, the body will start adding the acidic component into the blood to achieve the same state of equilibrium. Now, this achievement can either be done by adding an acid or by the removal of a base in this specific case. And in this upper case, if you want to achieve the more alkaline state, either you have to remove these acidic components or you have to add the base. Now, if the component is respiratory, like acidosis or alkalosis, the equilibrium will have to be achieved by metabolic component. So, if there is more acidosis, the body will go towards the equilibrium by metabolic alkalosis. It will activate the system in the blood that will try to accumulate the base component that will make the pH go towards the normal side. In the same way, if there is a respiratory alkalosis, the body will activate the system of metabolic acidosis. This is a very important concept. To recapitulate it, let me tell you, if a person is having respiratory acidosis, the body will try to make an equilibrium with the alkalosis of metabolic component. And if the body is having respiratory alkalosis, the body will try to achieve equilibrium with metabolic acidosis. Now, in the reverse case scenario, if the body is having metabolic alkalosis, it will try to balance it with the respiratory component, and in respiratory component the acidosis will help us to achieve the equilibrium. Same is true for metabolic acidosis. If the body is primarily having metabolic acidosis, it can get the equilibrium with respiratory alkalosis. Now, this is the most important concept. If you didn't get the point, just say it again and you will surely get the grasp of it. Now, let's pick up the each component individually. First, let's talk about metabolic acidosis. So, what will happen in metabolic acidosis? We already know the pH, it will be less than 7.35. You know, the normal range is 7.35 to 7.45. So the pH will drop down from 7.35. Now I have told you that metabolic component is mainly controlled by the bicarbonate. And what will happen to the bicarbonate level? Bicarbonate is a base. To drop down the pH to more acidic side, what will happen to the base? It will get low. And what will the body try to do? The body will try to achieve the state of homeostasis or equilibrium by the respiratory component, that is CO2, and that is an acid. Body is already going towards the acidic side. We don't want to accumulate more acid, we just want to go towards the basic side. So, for going towards the basic side, the CO2 in the blood will drop down. Hence, in metabolic acidosis, the pH will be lower from pH will be lower than 7.35. As it is metabolic acidosis, the bicarbonate will be the culprit. The bicarbonates, these are the culprits. So in metabolic acidosis, the bicarbonate level drops down. As a result, the CO2, which is acidic in nature, it tries to drop down to keep the body in the state of equilibrium. Well, it can either be normal as well, because this is the component that will take the body towards the equilibrium state. It depends that body has achieved the equilibrium as for now or not. What are the examples of metabolic acidosis? The biggest example that I can quote is diabetic ketoacidosis. You would have come across many of the patient. You would have come across many patients of DKA. Other example I can quote over here is lactic acidosis and kidney disease. That also include renal tubular acidosis, chronic kidney failure. They all can lead to the metabolic acidosis. So what about metabolic alkalosis? We know that in alkalosis, the pH should be more than 7.45. It should be towards the basic side. As it is metabolic, so bicarbonates will be the culprit here. Bicarbonate is a base in nature. I have already told you. So the quantity of bicarbonate in the ABGs will be higher. As a result, the body, to achieve the equilibrium, what will happen to CO2, that is an acid in nature, to bring the body towards the normal side, the CO2 levels in the blood should increase. However, it could be normal. I will be talking about this normal stuff in a little while. What might be the examples of metabolic alkalosis? Very right. First one, excessive vomiting. And number two, I can think of excessive use of antacids. Third example, excessive use of diuretics. Now, what are the mechanism how these things cause metabolic alkalosis? Let's not dive into that because it will make the video very long. Let's move on towards the respiratory acidosis first. So it's acidosis. The pH must be less than 7.35. It is respiratory. The culprit will be CO2. CO2, we already know that it is an acid. So, to make the pH more acidic, what will happen in the blood? There will be accumulation of carbon dioxide. As a result, to make the body go towards the equilibrium, what will happen to a base? The base will start accumulating in the blood, or it could be normal. What are the examples for respiratory acidosis? Most common, COPD. Then there could be drug overdose. in which a person become unconscious and it's really hard for him to breathe. Then there is Guillain-Barré syndrome and myasthenia gravis. Basically, you are not able to breathe in these conditions like GBS and myasthenia gravis, and you start accumulating carbon dioxide into your blood due to your lesser respiratory drive. That brings me towards the last component. It is respiratory alkalosis. So it is an alkalosis. Surely the pH will be more than 7.45. As it is respiratory, that is an acid. What will happen to the CO2 levels in the blood? They drop down. As a result, the body wants to achieve the equilibrium through the base. What will happen to the bicarbonate levels? They will start getting higher and higher, or it could remain normal as well. So, what are the examples of respiratory alkalosis? You would have seen many patients of respiratory alkalosis, anxiety, hyperventilation, panic attack. Usually, in panic attack and in anxiety, a person starts hyperventilating and start removing carbon dioxide from the blood. Another example we might quote is fever. Your respiratory rate gets higher and higher. Now, there is another example, asthma, and it is a little debatable. There are certain conditions in which initially in a patient of asthma, the patient starts hyperventilating, so carbon dioxide drops down. The patient goes more towards the alkalosis, and afterwards, when the patient gets exhausted, the CO2 starts accumulating due to the lower drive of respiratory system. Patient is already exhausted, so the patient starts having respiratory acidosis. Another important concept about these ABGs, whenever body starts to compensate about any disturbance in pH, there is either this compensation will be fully compensated state or it can be uncompensated. There is a third category as well, which is called partially compensated. Let me give you a quick idea about all these three so that you can understand these conditions a little better. If the pH gets disturbed, the body will start its defense mechanism to keep the pH again in the normal range. In compensated state, the pH of the blood becomes normal, while CO2 and bicarbonate, they are both abnormal. So one will be abnormal in the first place. To make the pH abnormal first, that will be our primary component. For example, if I will take an example of metabolic acidosis, first, for example, the pH of the blood was 7.32 as it was metabolic. So bicarbonate should be lower. For example, bicarbonate would have been 18. So PCO2 was in normal range. So it is a typical example of metabolic acidosis. So if it gets compensated, the pH will become normal. Say for example 7.37, as the primary component was bicarbonate, it will still be deranged as the body is going to compensate for this lower bicarbonate level. The PCO2, being an acid, it will drop down. It will be getting removed from the blood. For example, it will become like 32. Well, look at this example again. In the first place, the pH gets disturbed due to the metabolic component. We label it as metabolic acidosis, and then body's defense mechanism intervene. They make the pH bring in a normal range. While there was a primary abnormality, the bicarbonate was 18. It is not able to correct itself, so the correction will happen to the with the other respiratory component. As a result, the acidic gas will get removed from the blood. So PCO2 will become lower and lower in the blood to keep the pH in the normal range. Hence, this pH coming to the normal range with the other both components disturbed, abnormal, it is called compensated state. In uncompensated state, the pH is abnormal. So in other components, CO2 and bicarbonate, one of them will be abnormal and the other one will be normal. For example, in the let's take the similar example. 7.32 was deranged pH. Now, one of them, for example, this HCO3 is 18, it becomes metabolic acidosis. The other component will be still normal. This condition is uncompensated metabolic acidosis. Now, what is partially compensated state? In partially compensated state, the pH will be closer to normal. It will be not normal, but it will be closer to normal side. So one of these components will be deranged and the other one will be slightly deranged. It will be slightly deranged. So let's just take the similar example towards partial compensation. What will happen if in this uncompensated metabolic acidosis, if it will get partially compensated metabolic acidosis? The pH will go towards nearly normal side. It may become 7.34. The bicarb was primarily deranged, so let's keep it 18. And what will happen to the PCO2 levels? They will be slightly abnormal. For example, they could be like 34. The body is going to maintain the equilibrium, and as a result, in metabolic acidosis, the PCO2, the respiratory component, being an acidic gas, it should become lower in the blood. So it has just started going towards the lower side. The pH is still uncompensated. The primary component that was the cause of the metabolic acidosis, that is abnormal. The PCO2 has started to do the compensation for this deranged pH, but it has not compensated fully. And this brings me to the last portion of this ABG's lecture video. The algorithm of determining the abnormality in ABGs. So whenever the ABGs come in front of you, first of all, look at the pH and determine what is your pH. Is it acidic or is it basic? There could only be two possibilities. Either the pH is acidic, it is less than 7.3, 7.35, or it could be basic. The pH will surely be more than 7.45. Now, what is the second step? Look at HCO3 and CO2 together and determine the primary component of the abnormality. Now, depending upon the values, either the pH is acidic or the basic. Now, once you determine the pH that it is acidic, you look towards the carbon dioxide and bicarbonate. Bicarbonate, if you find that bicarbonate is lower than the normal limit, then it might be acidic. The compensation will start with carbon dioxide, PCO2. This PCO2, depending upon whether the body has achieved compensated state or it is still uncompensated, the carbon dioxide should be normal, or it should start getting low in the blood. It will label it as metabolic. You look at the pH in the ABGs, you find it acidic. Next, straight away, look at the carbon dioxide, partial pressure of carbon dioxide, and bicarbonate. One of them will be complying with the acidic nature of the pH. Which component it is? If it is bicarbonate, for example, if it is bicarbonate, it is lower than the normal limit, less than 22, less than normal, then it is the primary component that is deranging the pH, and the compensation will start with PCO2 that could be normal, or as a result of compensation that would have gone down. So we will label it as a case of metabolic acidosis. Now, if you look at the pH and you find it acidic less than 7.35, you look at the bicarbonate and you look at the PCO2 levels. Now, HCO3, this bicarbonate, you find it normal. Then your problem lies in this component, carbon dioxide. It must be higher to make it a primary component that is the culprit, making it respiratory acidosis. What will happen as a result? The bicarbonate will try to take the body back towards the equilibrium. And to achieve that equilibrium, the bicarbonate levels in the blood should start rising up. But still, it depends upon the body has achieved equilibrium or not. Yet, it is in compensated state or in uncompensated state. So, the pH is acidic. You find a lot of PCO2 in the blood, and the bicarbonate is still in normal limit, that is 22 to 26, or it has started rising up towards like 28 or 29. That is your respiratory acidosis. Now, what if you find pH more than 7.45? You know that it is alkalosis. Now, alkalosis can be of two types. It could be respiratory alkalosis or it could be metabolic alkalosis. The next step is look at the CO2 and bicarbonate together. You know that bicarbonate is metabolic component while CO2 is respiratory component. This is an acid. This is a base. If you find in the ABGs higher level of HCO3, then that means the base is accumulating into the blood, making pH going towards more than 7.45. As it is a metabolic component, it will label the ABGs as metabolic alkalosis. So, if it is a metabolic alkalosis, the compensation is going to happen with respiratory acidosis. We know that this CO2 is an acidic component and is the respiratory component of acid base system. What will happen to CO2 as a result? The CO2 will start going up, or it could be normal depending upon the condition, if the body has achieved the equilibrium or not, if the body has compensated or still in the state of uncompensated, or is it partially compensated state. So you look at the pH, it is more than 7.45, which is alkalosis. You look at the bicarbonate levels and CO2 levels and determine the primary component that is the reason of this alkalosis. You know that bicarbonate is a base. If it is higher in the blood, then it is metabolic. As a result, carbon dioxide is gonna get accumulate in the blood to keep the blood normal. So it become metabolic alkalosis. Now you again look at the pH. It is more than 7.45. You determine that it is alkalosis. Now look at the PCO2 and look at the bicarbonate together. For example, you find the bicarbonate 25, which is normal. Then you look towards the PCO2 levels, and PCO2 level, this is by the way an acidic gas, you already know. Its level has been dropped down to 30. You know that it is the respiratory component, so it will be respiratory alkalosis. As it is respiratory alkalosis, the body will try to maintain the equilibrium with the metabolic component, and in the metabolic component, that too with acidosis. So the body will respond with the metabolic component of acidosis by lowering down the bicarbonate levels in the blood to counter this respiratory alkalosis. The bicarbonate levels will drop down, for example, towards 20 or 19 by removing this bicarbonate from the blood. So, whenever ABGs come in front of you, look directly at pH and determine whether it is acidosis or alkalosis. Then straight away look for the bicarbonate and CO2 levels. Depending upon their increase or decrease, they could be labeled as metabolic alkalosis, the first one increase, or acidosis, the decrease. And as far as CO2 goes, depending upon its increase, it become respiratory acidosis, and its decrease becomes respiratory alkalosis. So that was all about the ABGs. I hope this will clear all your concepts about the ABGs and how to read them. One last point you should never ever forget, that is, always correlate with the clinical presentation of the patient. Sometimes there are more than two components of acid base disorder that are in play, that are called mixed disorders. So, if you want to know about those ABGs and those conditions and how do we interpret these kind of ABGs, please follow me. Soon I will be uploading another video about that. Thank you and remember me in your prayers.